Alright, good day. My name is Brett Edwards. Today we're going to be doing an assessment of the knee. This is my patient today. I've informed her and we have informed consent. So, initially, before any form of assessment, you want to obtain a good clinical history about the injury, as well as the potential mechanism of injury if that's available. Next, you want to assess the posture. Have the patient standing barefoot with her feet together. From there, you want to be looking at the position of the patella, noting any varus or valgus forces, possibly looking at whether the patella are either facing in towards each other or outward, indicating either internal or external femoral rotation, tibial torsion forces, as well as the pes planus, any positioning of the feet, with the pes planus increasing. So with flat feet, there's a potential for increase in tibial torsion, which will lead to more patellofemoral injury. Okay. Next, you want to evaluate any bruising, swelling, any muscle difference between left and right, making sure the muscle bulk is the same. Next, you'll have her walking. So I'll just have you stand over here and you can just walk straight forward. That's it. Okay, and then walk towards me. Good. Can I have you roll up? Yeah. Okay, good. Try that again. Good. Always important to make sure that you can evaluate the area efficiently. Okay, let's have you standing next to me. I'm going to have you go onto your toes and tiptoe walk all the way there. Good. Get onto your heels and walk towards me. Good. Okay, you can stand over there. So, using those tools, we're just evaluating neuromuscular function. Obviously, this patient is able to do that without any issues. So we'll move on. We're just going to have you laying on your bed, on your back. Perfect. Okay. Here we'll evaluate any. Can you pull your toes up towards you? Pull, pull, pull. Pull. That's it. Good. And then push down. Good. Okay. Again, just evaluating neuromuscular function, eliminating any kind of radiculopathy that may be present. Using the straight leg raise, you can lift it up. That's it. Okay, and down, keep it straight, and lift and down. So keep your legs straight, and lift, that's it, good. And down, and then compare that to that side, lift up, and down. So making sure there's no back pain or anything like that with these kind of issues. Also, you want to eliminate any potential hip pathology, which may be causing the knee pain. Get the knee flexed, 90 degrees of knee flexion, 90 degrees of hip flexion, and internally rotate. Make sure there's no pain with those movements, which could potentially lead to knee pain. Okay. At the same time, you can then look at the muscles, palpate and evaluate. Palpate the tendon onto the superior pole. From the inferior pole of the patella, palpate the patella tendon onto the tubercle. Palpate the medial and lateral borders of the patella. Palpate any medial plica, which may be possible pain-causing region. From that medial border of the patella down into the medial joint line. There, as well as Gerdy's tubercle, the attachment site for the ITB coming down. A really good test for those would be the Obis test and the modified Thompson's test, which we've done in the previous examination. So we could make use of those and then obviously compare left and right as well. Then what we'll do is look for any joint effusion. So the most notable effusion is generally caused by either ACL injury, meniscal injury, fracture, or patellar dislocation. and that is quite visible, especially in this suprapatellar band over the quadriceps tendon. Normally you want to try and mobilize that effusion distally and then see for that floating patella type of injury where you'll feel under the patella a very soft and bouncy area indicating capsular effusion. Okay. A more subtle effusion is often noted with more meniscal type injuries. For that you can palpate along the joint line medially and laterally. With these it will indicate either one, form of arthritis, or two, a medial or lateral meniscal injury. For Lachman's test, you want to use a towel or your own knee. Place that under the patient's knee to try and get about 30 degrees of flexion. You're going to stabilize the femur with one hand and then mobilize the tibia with the other in an anterior and posterior direction, feeling for a nice hard end feel. Okay. With that. Next we'll go into a posterior draw test. So we'll get the patient's knee into about 90 degrees of flexion. I like to stabilize with my leg, making sure that no bony prominence on my side is interacting with any bony prominence on the client, and one hand along the joint line and posteriorly depress the tibia, noting any excessive joint line movement, and compare that to the opposite side for the patient's normal. Medial and lateral assessment, so the MCL and the LCL, you want to get into about 30 degrees of knee flexion, add a lateral force for medial assessment and a medial force for a lateral assessment. The 30 degrees is quite important. You don't want to be in a full extended position. That will test other collateral ligaments as well as the posterior capsule. So the posterior lateral corner, quite important in assessment when looking at LCL, the popliteus as well as the PCL. These areas all contribute to damage in the posterior lateral corner. And for this you'll just externally rotate the tibia, and with downward depression, any excessive or clunking movement will indicate damage to the posterior lateral corner. Meniscal assessment, we'll do the bounce home test. So slight knee flexion and let it bounce into full extension. Any pain along the joint line that the client may experience may lead you to believe in a meniscal injury. Next we'll look at McMurray's test. So with one hand along the joint line, you're going to add slight rotation of the tibia, and then from a flexed position you want to move into an extended position, testing the lateral side, and with the medial rotation of the tibia as well as a medial force, you'll test the medial meniscus. Okay. Apley's test, I'll let you roll over to the stomach. Okay, for Apley's test, 90 degrees of flexion, and you're just rotating the tibia onto forming a compression force within the knee, as well as a lateral rotation there. Okay, you can roll onto your back. Okay. Okay, you always want to try and compare left and right, looking for any discoloration in there. Okay, to finish off, we'll do a standing McMurray's test. Get your patient standing. And for this one, we're going to have the toes apart. That's it. And then go into a squat. There you go, good. And then toes together and go into a squat there. Good. Okay, and that concludes our assessment. Thank you.